Hi there and welcome back. Let's review sarcoidosis today. We'll get into the overview, causes, symptoms, statistics, how do we diagnose and treat, and the bottom line, underwriting. Sarcoidosis is an inflammatory disease that affects multiple organs in the body, but mostly the lungs and lymph glands. In people with sarcoidosis, abnormal masses or nodules called granulomas consisting of inflamed tissues form in certain organs of the body. These granulomas may alter the normal structure and possibly the function of the affected organs. The exact cause of sarcoidosis is not known. It may be a type of autoimmune disease associated with an abnormal immune response, but what triggers this response is uncertain. How sarcoidosis spreads from one part of the body to another is still being studied. Theories include viral and mycoplasma infections as well as hypersensitivity and autoimmunity. It may run in families and there may be a genetic contribution. So what are the signs and symptoms? The symptoms of sarcoidosis can vary greatly depending upon which organs are involved. Most patients initially complain of a persistent dry cough, fatigue, and shortness of breath. Other symptoms may include development of abnormal or missed heartbeats, arrhythmias, inflammation of the covering of the heart or pericarditis or heart failure. Nervous system effects including hearing loss, meningitis, seizures, or psychiatric disorders such as dementia, depression, psychosis. Another symptoms include kidney stone formation, enlarged liver, hoarse voice, pain in the hands, feet, or other bony areas due to the formation of cyst or an abnormal sac-like growth in bones. The symptoms also include enlarged and tender lymph glands in the neck, armpits, and groin, enlarged lymph glands in the chest and around the lungs, tender reddish bumps or patches on the skin, red and teary eyes or blurred vision, swollen and painful joints. So what do we have as far as statistics are concerned? Most common in women and African Americans. Family history of the disease is common. It affects young and middle-aged adults. One data indicates incidence in the United States is 6 per 100,000 per year, and relapse occurs in the majority of the steroid-treated patients within 3 years. Another data suggests remission or stabilization occurs in 66% of cases within 2 years. Extrapulmonary, particularly hepatic, involvement occurs in 20 to 75%. Spontaneous remission is frequent, and yet another data out there that indicates about 10 to 20% of patients with sarcoidosis go on to develop progressive fibrosis with damage to the lungs, eyes, heart, or nervous system. Hypercalcemia is a rare finding in sarcoidosis, but if left untreated may be associated with renal stone and or progressive renal failure. So with that being said, how do we diagnose? There is no single way to diagnose sarcoidosis. since all the symptoms and lab results can occur in other diseases. For this reason, your doctor will carefully review your medical history and examine you to determine if you have sarcoidosis. The main tools your doctor will use to diagnose sarcoidosis include chest x-rays to look for cloudiness, pulmonary infiltrates, or swollen lymph nodes, or say lymphadenopathy. High resolution CT that will provide an even more detailed look at the lungs and lymph nodes than provided by a chest x-ray. PFTs that you typically see in medical records, the pulmonary function test, to measure how well the lungs are working. Bronchoscopy to inspect the bronchial tubes and to extract a biopsy or a small tissue sample to look for granulomas and to obtain material to rule out infection. Bronchoscopy involves passing a small tube, bronchoscope, down to the trachea or the windpipe and into the bronchial tubes or airways of the lungs. Let's move on. How about the treatment? It generally falls into two categories: maintenance of good health practices and drug treatment. So the good health practices include getting regular checkups with your healthcare provider, eating a well-balanced diet with a variety of fresh fruits and veggies, drinking enough fluids every day, getting 6 to 8 hours of sleep each night, exercising regularly, managing your weight, and quit smoking. Drug treatments are used to relieve symptoms and reduce the inflammation of the affected tissues. The oral corticosteroid prednisone is the most commonly used treatment. Fatigue and persistent cough are usually improved with steroid treatment. If steroids are prescribed, you should see your doctor at regular intervals so that he can monitor the disease and the side effects of the treatment. Other treatment options include methotrexate, hydroxychloroquine, or simply speaking plaquenine, and there are other drugs out there. Okay, so enough on the treatment. So that's about the sarcoidosis. How do we underwrite? As far as underwriting goes, follow your underwriting manual. There may be variations depending upon what underwriting manual you are using. Plus modify that rating with the final company specifics, unique based on the actuarial data and the other tools you use internally to come up with and extend the most aggressive offer. Okay, let's take a break here. See you soon. Take care. Bye now.